Hello guys, I am from Menomics Med. We will learn autosomal dominant disorder examples. Menomic is heavy dominant. H for hereditary spherocytosis, E for Ehlers-Danlos syndrome, A for achondroplasia, V for von Willebrand disease, Y for pseudohypothyroidism, D for dystrophy myotonica, O for osteogenesis imperfecta, M for Marfan syndrome, I for intermittent porphyria, N for neurofibromatosis 1 and 2, A for adult polycystic kidney disease, N for Noonan syndrome, and T for tuberous sclerosis. So we have to remember heavy dominant. We can memorize easily by this menomic. Hereditary spherocytosis disorder, where abnormalities of RBC structural protein leads to loss of RBC surface area. RBC, it is spherical shape. There is a hyperdense, poorly deformable, shorter lifespan. So we can remember few points of hereditary spherocytosis. Ehlers-Danlos syndrome. It is group of related genetic condition caused by defective collagen synthesis. Main cause is mutation on a gene that encodes for a type of collagen. Some types also follow autosomal recessive symptoms. So these are the main symptoms of the Ehlers-Danlos syndrome. You have to remember that it is a achondroplasia. It is a disorder of short stature. It is caused by gene mutation. There is short metacarpal, short phalanges, flat bone defects. It is a most common type of short limb dwarfism. So you have to remember this many points for achondroplasia. Von Willebrand syndrome. Main clinical features include easy bruising, skin bleeding, prolonged bleeding from mucosal surfaces. These are main clinical features of von Willebrand syndrome. You have to remember this much symptoms. Y for pseudohypothyroidism. It is a disorder which in the body fails to respond to parathyroid hormone. Dystrophy myotonica. It causes progressive muscle wasting. Osteogenesis imperfecta. It is a type 1 collagen defect. Main triad is blue sclera, multiple fractures or fragility of bone, and there is also deafness also seen. You have to remember triad because you can find from blue sclera, multiple fractures or fragility of bone and deafness. Marfan syndrome. M for mitral prolapse, A for aortic dissection, R for recurrence of aortic valve, F for fingers are long, arm span is more than height, N for high arch palate, S for sternal excavation. It is mainly due to mutation in gene called FBN1. I for intermittent porphyria, N for neurofibromatosis type 1 and 2, A for adult polycystic kidney disease, N for Noonan syndrome, and T for tuberous sclerosis. You have to remember all these examples in exams. You can get any examples. Please guys, like, share and subscribe. Thanks for watching.